Well, hey Anatomy, hope you're doing well when you watch this video. Today we're going to be talking about the heart, part two, electrical systems of the heart, and also veins and arteries, and the electrical system of the heart. So let's go ahead and get started. What are the heart's two jobs? So if we could summarize this, we would say, okay, its job is to pump blood, but not only that, it also needs to remember to pump the blood. It has its own electrical system. You ever go to the ER or emergency room or sometimes even urgent care, sometimes they'll give you an EKG, especially for older people or some people complain of heart pain. And what they'll do is they'll hook up electrodes to your chest, and because your heart has an electrical system, they can print those readouts with a machine. And you can see here the circular regions. This is abnormalities in a heartbeat. Cardiologists and doctors know how to read these. There's different leads that record different electrical signals. You can see here that this is also an irregular heartbeat. And so you can see that a normal looks like this, and then there's also irregular heartbeats known as heart blocks. There's first degrees and second degrees and even third degrees. You can see here that the heart is actually not beating. It's charging up to kind of beat, but it doesn't beat. And so that's the questions part one I want you to define. What is heart block, and how does someone develop heart block? Sometimes there's risk factors, but also sometimes there's causative agents like drugs or medications maybe. And so I want you to look up that for questions part one. So the cardiac cycle, your heart beats, of course, you know this since you were young. Lub dub, right? And so the cardiac cycle consists of alternate periods of contraction and relaxation. Contraction is systole. Blood is ejected into the ventricles, and blood is ejected into the pulmonary trunk and the ascending aorta. Relaxation is diastole. So the heart has to contract, it has to relax. Chambers are filling with blood. So the cardiac cycle, again, consists of two phases. Systole, which is contraction, and diastole, which is relaxation. And so the sequence of contractions work like this. Relaxation, atria contracted together first, atrial okay, so blood's pooling in there, atrial they push blood into the ventricles through those valves, ventricles are relaxed and filling. The ventricles then contract next, so that's ventricular systole, and they push blood into the pulmonary and systemic circuits. Remember, I would ask you in class which one is pulmonary, which one is systemic, but the right side is pulmonary of the heart and the left side is systemic. Atria are relaxed and filling. Typical cardiac cycle lasts about 800 milliseconds. That's roughly 75 beats per minute. So you can take your pulse. Most people just take it for 10 seconds and multiply by 6. Don't take it with your thumb. There's a pulse in your thumb, so you could like get a misreading. But here's like a kind of a chart here as far as the cardiac cycle goes. So you can see here at the start, okay, atrial systole, contraction, and then ventricular systole, and then you have relaxation. So it's lub dub, relaxation, and then lub dub, like that, And so it cardiac cycle. So relaxation, atrial contract first, ventricles contract second. So questions part two, I want you to define the cardiac cycle, and then what are some drugs or foods that would change the cardiac cycle? I don't know if you ever had anything to eat or taken a medication and then your heart just felt different. I want you to look that up. Give me some examples, 3 or 4. So, okay, so autorhythmicity is the cardiac muscle's ability to contract at its own pace independent of neural or hormonal stimulation. So the heart has its own electrical system. Conducting system is a network of specialized cardiac muscle cells, pacemaker and conducting cells that initiate and distribute a stimulus to contract. We're talking about action potentials here, similar to the nervous system that we studied way back in August and September. So components of the conducting system is the sinoatrial node or the pacemaker. Internodal pathways, I'm not going to talk to you much about those in this video. Atrioventricular node, AV bundle and bundle branches, and Purkinje fibers. Okay, so that is the heart's conducting system. So it's intrinsic. The heart muscle cells contract without nerve impulses in a regular, continuous way. One more time, here is the order of them. Sinoatrial node, which is considered the pacemaker. AV node, atrioventricular bundle, bundle branches, and Purkinje fibers. I'll show you a video here if we were in class, but we're not, so we'll just keep going here. But sinoatrial node, here's the pacemaker, and so here's where the axon potential begins. Again, cardiac cells are connected through those desmosomes and gap junctions, so they beat together. And then it transfers to the AV node, down the bundle of His, AV bundle. It splits, because there's two sides of the heart, into the bundle branches. Sorry that this stuff's popping up. Bundle branches, and then it splits to the lateral sides of the heart through the Purkinje fibers. Okay, so cardiac electrical connections. How does these connections happen? Well, I already had you kind of research these in another question, but desmosomes, right? Gap junctions allow these electrical signals to transfer heart cell to heart cell very quickly. This is actually a study, a research study done in a scientific journal. But I want to highlight something for you. Cardiac desmosomes and the rhythmogenic, so the beginning of arrhythmias, wrong heartbeats, and cardiomyopathies, which is diseases of the muscle cells of the heart. So right here, recognition that some forms of arrhythmogenic cardiomyopathy are caused by mutations in desmosomal protein genes has galvanized interest in biology of the desmosome and its interactions with other junctional molecules. So what they're finding is sometimes there's mutations that cause people to not to have a heart that doesn't beat correctly, and these are literally on the protein level of desmosomes. And so what they're doing is they're trying to research this to better understand that. And so here's just another picture of the conducting system, 1, 2, 3, 4, 5. I would know it in order. I would understand what the goal here of this system is. And so let's go over that really quick. So here's the action potential, okay? Remember, ions are rushing into cells, creating an action potential. So an action potential is initiated in the SA node. It's spread to the atrial muscle, spreads to the atria, to the AV node where conduction slows, okay? That slowing allows, ventricles to fill with enough blood. Action potentials travel rapidly through the conduction system to the apex of the heart. The apex, of course, the bottom part of the heart right down there. Action potentials spread upward through the ventricular muscle, eventually the entire heart, which causes them to beat very forcefully, returns to the resting rate, remaining there until another action potential is generated in the SA node. It's pretty humbling if you think about it, because you're not in control of that SA node working or not. Maybe that's just me speaking from my issues with heart, palpitations and stuff that I deal with, but it's humbling. It's very humbling to feel your heart beat incorrectly. You realize you're not in control. You realize that you don't have any hope or prayer in saving yourself or healing yourself, really. Yeah, medications and stuff, but they're not foolproof and they have side effects. And so your only hope is in Jesus, which is pretty cool when you come down to think about it, because he loves us so much. So here's just another picture of this. You can kind of pause and read through it. I already discussed it in the pre. I just wanted to give you another picture in case you want to look at it. So here is a picture from Pearson. So the cardiac conduction systems here. So here it is. EKG, which we already kind of showed you. I'm going to show you a little bit more here in a second. But sometimes it's called EKG because cardia is K, with a K in German and stuff. But action potential generated at an SA node. Atrial activation begins. And so you can see here the milliseconds. Stimulus spreads across atrial surfaces within intranodal pathways to AV node. Okay, so that action potential spreads through the atria. So the atrial depolarization. So they're contracting. Okay. A 100 millisecond delay occurs at the AV node. So the atrial contraction occurs. So depolarization, repolarization, P node. So then the conduction through the AV node and AV bundle. The next slide here. Impulse travels along the ventricular septum within the AV bundle. The bundle branches to Purkinje fibers to the papillary muscles of the right ventricle. Ventricular contraction begins. So QRS is ventricular contraction, completion of ventricular depolarization. Impulse distributed by the Purkinje fibers, and then the end of it is relaxation, PQRS, and this last one is known as T. I'll show you a better picture here in a second. So the sinoatrial and AV nodes, literally 80 to 100 action potentials per minute on average. Some chemicals that you automatically made, like acetylcholine, slow that down. Bradycardia is a slow heart rate. Sympathetic response, fight or flight, speeds up the heart rate. That's called tachycardia, fast heart rate. And so here's a a picture here of the PQRST. Again, this is what you would see, and you've seen this in tattoos in various places, but this is what they're looking for on an EKG, and they can see, based upon an EKG, what the heart is doing. The atrial diastole, relaxation, atrial systole, there's a contraction, right? QRST is the beginning of ventricular systole, and then it relaxes at the end to allow the blood to return. And so it's a little blurry here, but P wave, depolarization of atria, delay of AV node. QRS complex is depolarization of ventricles, triggers main pumping contractions. Again, depolarization is basically the flipping of the charge, right? All those ions have rushed in, the action potential is spreading. Ventricular repolarization, is at the T wave. So they're getting ready, they're getting recharged, reset to pump again. And so sometimes though they actually even study on an EKG a QT interval. If you're prone to some really popular antibiotics like erythromycin, if you ever taken the Z-Pak, can increase a QT interval. Of course, it's rare, but you gotta be prone to. But long QT syndrome is a heart rhythm disorder that can potentially cause fast, chaotic heartbeats. These rapid heartbeats, might trigger like sudden fainting or seizures or various places like that. Sometimes it can lead to cardiac arrest if it beats incorrectly. But that's also something to measure on an EKG or electrocardiogram. So here's kind of what it looks like. You lay down, they put all the electrodes on you. I've had so many of these, it's great. And graph the heart's electrical system. Depolarization triggers contraction. Repolarization begins just before the relaxation phase of the cardiac muscle. So again, they're measuring this. This isn't probably an older picture. Their machines are a little bit more advanced now, in some places at least. And you can kind of watch this, and it's really cool. I mean, it obviously helps people live. So question part 3. I want you to define autorhythmicity. That's fun to say. If the cells of the SA node fail to function, how would the heart rate be affected? All right, so think about that. And then why is it important for impulses from the atria to be delayed at the AV node before they pass into the ventricles? I probably already answered that for you. Questions part 4. I know some people have pacemakers. I'm sure you do too. What is a pacemaker? Like artificial. How is it installed in the patient? Like seriously, like what? Think about research it, but what do doctors have to do? What do they have to open up? What do they have to, where do they place it? I mean, that might differ depending upon exactly, but the situation. But what do doctors do? And finally, how does it function when it is working properly inside of a patient? What does it do to ensure that that patient's heart is beating correctly? Blood vessels. The last thing I'm going to talk to you about as far as the cardiovascular system goes, this is more of a circulatory system, but I just want to briefly introduce it to you. Blood vessels. Arteries, away, A for away. Arterioles are the smallest branches of arteries. Capillaries are the smallest blood vessels. This is where gas exchange occurs and exchange between interstitial fluid. Venules, which are collect blood from capillaries, and veins, which return blood to the heart. There is a layering of these, tubes inside of our body. The tunica intima is the innermost lining. Media is the middle layer. It contains sheets of smooth muscle, and then externa contains connective tissue sheets. So here is your picture here. Endothelium, tunica interna, media, externa, and you can see this underneath a slide. So arteries, strongest of the blood vessels. Under high pressure, they carry blood away from the heart. The aorta takes blood from the heart to the body. These are some of them, that's like the major artery. Coronary arteries, of course, supply blood to heart muscle cells. Carry blood from the heart to capillaries in all parts of the body. By constricting or dilating, they maintain arterial blood pressure. So I don't know if you ever felt your blood pressure rise or not, but it exists. It happens. You can see here that there's muscular arteries and elastic arteries, and your blood pressure can increase, and you don't really control that. So, to help you survive. Atherosclerosis is the last thing I'm going to ask you to look up as far as heart goes. But I want you to see this. Arteriosclerosis is literally, or atherosclerosis is literally a hardening of the arteries due to like plaque and various factors. But here's what I want you to look at. The process Atherosclerosis begins early in childhood. That's what research is finding. Again, this is from a research article. They're influenced by risk factors that include obesity and high blood pressure, smoking, and by the presence of specific diseases. But also, you'll find out this also is involved with eating habits and lifestyles. So this is our last questions for the heart system. And then we'll briefly talk about the respiratory system in the next video, which will be the last video of the year. Questions part 5. Atherosclerosis. I want you to define it. What is it? Risk factors. How does plaque form and deposit itself in vessel walls? And what are the possible side effects of atherosclerosis? You can see here plaque formation in a vessel wall. God bless you. You can see plaque underneath the microscope too. So that's our last part. So that's a heart. It's amazing. It's complicated. It's humbling. I don't know about you, but it causes me to draw near to God because He knows what every single heart cell is doing. He knows when my heart will beat its last. And He's going to watch over me and guard me and take me home, and so it's going to be a good deal. But I hope these videos were helpful, guys. I hope you're doing well. Hope to see you soon. This quarantine lifestyle is pretty tough. So until next time, God bless.